Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Vickie, Leff, and Terry Altilio. They are palliative social workers and editors of the book Mirrors and Windows, Reflections on the Journey in Serious Illness Practice. Vickie and Terry, welcome to the show.
Thanks for having us.
Thank you.
So I'm going to ask each of you just to briefly share your story and journey to where you are today. Terry, why don't you go first?
Sure. I started as an oncology social worker over 30 years ago in a local community hospital. I did that for about 7 years. And then I went to Memorial Sloan Kettering in New York, stayed there for about 7 years, and then did about 15 to 20 years downtown at Beth Israel Medical Center. And then all doing palliative care and working during the building of palliative care as a specialty, which was an amazing time to think about retrospectively. Amazing time. And then I resigned. I did not retire. I resigned, and since then I've been working on books and doing talks and teaching.
And Terry, for those who aren't familiar with your field, tell us exactly what a palliative social worker is.
So a palliative social worker usually is working on a team, either in hospice or acute care settings. Now there's some palliative care also going on in the home care environment. And we really bring the skills of social work to the team in terms of understanding family dynamics, social justice issues on our better days, and really working with the team to meet and identify the psychosocial needs in patients and families who are working with serious illness. It's not a specific diagnosis. Palliative care has now infused many diagnoses. We work in the ED, we work in the ICU. It's very eclectic and very exciting and interesting work. So and social workers join with those teams, and the teams usually are nurses, physician, chaplains, and we are always joining, if you will, with the extended families in the ICU, those teams in the ED. And so our work is a constant process of joining with others to build and to create for patients and families the best kind of setting that they can have dealing with serious illness, given the problems in our healthcare systems.
And Vickie, tell us your story and journey to where you are today.
Well, it's very similar to Terry's. I also been working in medicine as a social worker for over 35 years. And I also started in oncology and have worked in palliative care and then a little sprinkle of hospice. And my particular focus, other than providing the best care possible, has been around the healthcare providers, folks like myself, other people on the team, and always really wondering about how do we do this for the long haul? Because Terry and I have been doing this for a long time. And it's often a struggle. It's often very, very challenging. And we talk about it amongst ourselves all the time. And I think that was part of and Terry can speak to this better than I can, the foundation of this book is to give that voice, because I worry all the time about how our colleagues and ourselves get through this work, given how difficult it has become over so many years.
And Vickie, let me ask you, what keeps you going in this field? Because palliative care inherently is a very, very difficult field. You see very difficult situations and cases every single day. What keeps you going?
I love palliative care. I love it because it gives me as a clinician an opportunity to do a couple of things. One is to be at a moment when folks might be having the hardest time of their lives and try to be helpful to them, their families, and the team members. This is it's redundant to say it's a team sport, but all of us have a lot of impact on what happens to folks. And I think I really enjoy the opportunity to be able to translate between what somebody might be going through and their family going through to the team in maybe a different sort of lens than they're used to in training, so that we can all come together and provide the best care possible at that moment. The patients and families are what keep me going.
The book that both of you edited is titled Mirrors and Windows, Reflections on the Journey in Serious Illness Practice. So Terry, how did this book come together?
So, truth be told, Vickie Ann and I were at an annual meeting in New Mexico. We were sitting around a table having dinner, and I've been first editor of the Oxford Text of Palliative Social Work, I'm a third editor of something called the Guide for Health Social Workers, which is really moving palliative care. The text is a specialty work. The guide is about primary palliative care, because what we've come to realize is that if patients and families' needs are going to be met, it has to be palliative care needs to be infused all through the healthcare system. And in fact, many social workers are very much doing palliative care in their day-to-day work. And some of us are specialists in ethics and pain management and such like that. So we were sitting around the table, and after having done the Oxford text for the second time, the second edition, somebody said to me, "So what's your next book going to be?" And I said, "The only book I have left in me is a book of reflections." It's the only book I have left in me. And these two, Vickie and somebody named Dan Kellerman, said, "Oh, we can do that. We can self-publish it. We know how to do that." And I was like, "Oh, self-publishing. I know nothing about self-publishing." And that's how this idea, this last book I have in me, became what we're looking at right now, which is Mirrors and Windows Reflections. And I think, Vickie, and help me with this, I think really what we have come to realize is that in addition to this book informing people who are doing the work, it has enormous potential for teaching, because it actually brings the academic work to the real world of clinicians. It brings the joy, it brings the humor, it brings the fear, the anxiety, all of it to the real world of clinicians who have been able to stay in the work. So that, I think, is a message in itself. And the authors in this book, there are about 49 of them. The authors in this book are in different places in their careers. So they're speaking to the work from different perspectives. And I didn't realize, certainly, and I don't know if you did, Vickie, how valuable this work can be for teaching.
Yeah, Vickie. So tell us some of the stories that are included in your book. Just give us a sampling of what readers can expect from reading these stories.
Well, I don't know that I can say it any better than the contributors did. We asked them to write a brief essay, under 700 words, about a very generic question of how do you do this work and how has it impacted you in both reflecting to yourself and outwardly and so forth. How do you make that human connection? And the stories that we received from folks are so honest and beautiful and genuine. I could not do them justice, but I can tell you that it is the content is what I assume all of us talk about with each other as healthcare clinicians all the time, meaning that story that stuck with you, that patient that just you couldn't connect with, that ethical issue that just kept you up at night over and over again. The great things, the joys, the challenges of this work are told through their eyes. And the value of that is that although we've been talking to each other about it, I think it's often been in private. And what I loved about Terry's idea is that this would come to the public, not only for the world to see kind of what this work is all about, but as she said, it is such an incredible way to teach each other and at the same time validate each other around the difficult nature of this work. We cannot pretend that it's not difficult and hard. And we know that, so we can mitigate it. We're not going to get rid of it. And hearing each other's stories is so validating. How the death of the first patient that they had, and how they went and cried in the stairwell, and what that meant to them, and who came to them to help them, or the one that we featured on in our excerpt on your blog was from Chris Onderdak, who talked about what he brought home from a particular case and how that impacted how he spoke to and listened to his young children. Just very, very poignant and real and genuine. And I think that's what's unique about it. This is not a teaching book. This is a book
Right.
that can help people understand what this work really looks like and feels like.
As I was listening to Vickie, also, I was thinking that my neighbor, who has nothing to do with healthcare, I gave her a copy of the book and she read it. And so it was interesting to me because she's a lay person reading, the intimate stories of folks who do this work. And what she came away with was, I'm going to take the poem that's in the book and I'm going to put it in my packet of papers for my daughters when I get sick and when I'm coming to the end of my life, because that's the way I want to be taken care of. And I thought to myself, who would have thought that these reflections on some level not only validate and engage the work that we do, but also affirm the patients and the families, what they have taught us, what stays with us forever, because they change. We change their lives often, not always, and they certainly change the lives of many clinicians who do this work. And it's those singular moments, you asked what keeps you in the work. It's like those singular moments that stay with you forever, and the knowledge, which took me years to figure out, and the knowledge that you do not always know how you have impacted the life of another person.
Mhm.
You don't get told the power of the work that we do. And I think that's an important message for clinicians to keep in the back of their minds, because it's every once in a while you get an opportunity to learn that.
So, Terry, you said earlier that from reading these stories, we could learn so much from that world of palliative care. Tell us some of the overarching themes that you've noticed by collecting these stories, and what specific things can clinicians learn from reading these palliative care stories?
So I think one of the things, there were a couple of things I was thinking about as Vickie was talking. One of the things that is really powerful for me is the social workers who present situations that are not always ideal and figure out a way to make meaning in those situations, how to create the best circumstance for this family, for this patient. And some of that is humorous, and it asks us to put our judgments aside, put our judgments in the parking lot, and look at the strengths that people have, not what we want them to have, what we think is an ideal situation. And social workers are great at that, because we're taught to look at people in their environment. On our better days, we're great at that. So that was one of the things that touched me deeply. The other thing that is really unique, I suppose, for social work in some ways, is that Kevin, we're a minority in healthcare. We're a minority discipline, just like chaplaincy is a minority discipline. And there is a need, therefore, to find a voice to make an impact. And sometimes that impact is related to social justice, it's related to equity, it's related to aspects of care and aspects of our systems that people don't want to hear about. And so what you see in some of these reflections is the social worker saying, if you don't have a voice, you need to find your voice, because we as a profession purport to be social justice advocates, and we have not done a grand job of that, as you can tell by looking at the world we happen to live in. So those are some of the things that touched me. And also, it was just wonderful to be able to ask folks to do this, to see the ability to put something in 700 words that has meaning, with no references, with no bibliography. Like, this is you speaking, and you're going to be accountable for this, right? In your life, in your setting, somebody's going to read this, and you're going to be accountable for it. And some of it is amazingly rich and lovely, and I'm sure surprised the colleagues that many of us work with.
So, Terry, in terms of who contributed, were they primarily clinicians? Were they other members of the healthcare team? Just give us a sense of the breakdown of these stories and who contributed them.
They're all social workers, and we try to select social workers who have been or are in active practice. What other criteria did we have, Vickie?
That was it. Is that, have you worked in this work, and are you currently doing it? As opposed to, while the voice of an academic folk and so forth are certainly interesting, we really wanted to hear from how you get through your day, what has stuck with you, and as opposed to the teaching and so forth. So clinicians, but they're really all clinicians.
So, Vickie, we have an audience of clinicians on Kevin MD, primarily physicians. So, from listening to both of you and from reading this book, what are some messages that physicians specifically can learn from the palliative care world that you could impart with them?
Well, gosh, that's a big question and a big ask. I think primarily it would be in what they might glean from the reflections is the work that we all have to do ourselves in order to be present and genuine in the work we do with our patients and families. And that's taught to social workers day one. And it might not be as part of, or I don't think it is as much part of the curriculum for docs as I would like it to be, but it is really a critical. And it was just, I was just reading the piece on your blog, Kevin, about the genuine connection from Jennifer Tillman and how the interactions. And I know this is a pretty recent discussion in the field of physicians, and I'm so glad that it's being discussed. Social work has been doing this for a very, very long time. And I think that reading some of these reflections can validate and normalize the actual work that we do, because it's never really perfect, and that it's okay, that sometimes things don't go well. We try to learn our best from them. And I think humanizing that, I think physicians could learn a lot. They can also teach each other. I think they would resonate to the stories, the emotions, the impact, and then they can be able to translate that to their learners, students, fellows, to say, when someone asks you, so what's palliative care like? Here, read this 700-page essay, and it'll give you a taste, a real taste, not a didactic, not anything other than someone's true human situation in this work. So I guess helping them to be self-reflective, because that's so important, and being able to be genuine and real and make those connections with our patients and families and team members, and as Terry said, extended families in the ICU and the ER and so forth.
Vickie, when you asked your contributors to write these stories, did you get a sense that writing these stories was cathartic or even therapeutic on their part, given how difficult their stories are to tell?
I'm so glad you brought that up, because that was the response that we got from so many people. First, they were so gracious to agree to this, but then we often got comments afterwards that said, this was so powerful for me to write. It was so helpful to get it out there, because we don't always have time to do that. So yes, we didn't set out for that to be the mission. It wasn't intended for, okay, we want these folks to have this phenomenal experience. We wanted to bring to light and give voices where we've heard them all in the past. So thank you for bringing that up. Yes, it was very much so a very cathartic experience for many of the contributors.
Yeah, I want to go back to your previous question about what docs can get out of this book. And one of the things that we've been talking about, and that I think about a lot, is that I think our docs, I think demoralization in physicians has a lot to do not only with the pressures of the external world and all the demands on them, but it also has a lot to do with the fact that they look at outcomes and don't necessarily value the relationships that they have with patients and families. So that if you look at the outcome and the outcome's not what you want or not what your institution wants, you feel like you have not done a valuable service. And what these reflections, what they show is relationship, the value of relationship. And I think that if our docs could look at these reflections and understand the power of their relationship, in addition to what they do to folks and for folks and all that other important part of their job, that if they could prioritize the value and the power of their relationship, the process of that relationship, there would be less demoralization. Because the outcome would be the outcome, but by valuing the process of how they got there and what that relationship means to patients and families, I think they would feel better about the work that they do. So for me, part of what this book does is it speaks to all clinicians about the value of relationship and the power of relationship, what we learn from those relationships and what we give to others through those relationships. So that's our hope, that folks will take this book and use it in team meetings, use it for education, because some of it is funny. It's not, and some of it will make you weep, and that's the span of the work. Some of it is funny, and some of it makes you weep, and some of it makes you angry. So, yeah.
We're talking to Vickie Leff and Terry Altilio. They are palliative social workers. Their book that they edited is Mirrors and Windows, Reflections on the Journey in Serious Illness Practice. Now we ask both of you just to share some take-home messages to the Kevin MD audience. Vickie, why don't you go first?
I don't know that I can say it any better than Terry just did. I think that this book really is an opportunity for anybody in healthcare, whether it's serious illness or not. That's just where those experiences come from. Understand how powerful the relationship and human connection really is in healthcare. And this gives some phenomenal examples and beautifully written, honest examples of that.
And Terry,
Yeah.
your take-home messages to
I
Kevin and
think
the
the
audience.
take-home message is probably in the title, and Vickie shared this with me a couple of days ago. It's in the title, Mirrors and Windows, that this is a book that invites us to look at ourselves through mirrors, right, and our circumstances, and it invites us also to look through windows at the other, perhaps what might be possible as you look through windows, what you might be able to create. So I love the title. The title actually, which will, I suppose, be my last words. The title actually came from an article that I read a long time ago in the New York Times. And this author was writing about underserved communities and minority children. And it said that children of privilege need to learn how to look through windows instead of looking at mirrors. And underserved children, minority children, need to learn to look through mirrors, to look at themselves and look at others who are like themselves. And that's where that title comes from. And I think it's just a lovely title, and that's what I'd like to leave folks with.
Vickie and Terry, thank you so much for sharing your time and insight, and thanks again for coming on the show.
Thank you so much.
Kevin, for having us. Thanks a lot. Bye, Vickie.
Bye-bye.